What is dengue fever? Dengue fever is a disease caused by a family of viruses that are transmitted by mosquitoes. It is an acute illness of sudden onset that usually follows a benign course, with symptoms such as headache, fever, exhaustion, severe muscle and joint pain, swollen glands, lymphadenopathy, and rash. The presence of fever, rash, and headache and other pains is particularly characteristic of dengue. Other signs of dengue fever include bleeding gums, severe pain behind the eyes, and red palms and sores. Dengue hemorrhagic fever is a more severe form of the viral illness. Symptoms include headache, fever, rash, and evidence of hemorrhage in the body. Petechiae, small red or purple splotches or blisters under the skin, bleeding in the nose or gums, black stones, or easy bruising, or all possible signs of hemorrhage. This form of dengue fever can be life-threatening and can progress to the most severe form of the illness, dengue shock syndrome. How is dengue fever contracted? Dengue is transmitted by several species of mosquito within the genus Aedes, principally Aedes aegypti. The virus has 4 different types. Infection with one type usually gives lifelong immunity to that type, but only short-term immunity to the others. Subsequent infection with a different type increases the risk of severe complications. The virus is contracted from the bite of a striped Aedes aegypti mosquito that has previously bitten an infected person. The mosquito flourishes during rainy seasons but can breed in water-filled flower pots, plastic bags, and cans year-round. One mosquito bite can cause the disease. The virus is not contagious and cannot be spread directly from person to person. There must be a person to mosquito to another person pathway. What are dengue fever symptoms and signs? After being bitten by a mosquito carrying the virus, the incubation period ranges from 3 to 15, usually 5 to 8 days, before the signs and symptoms of dengue appear in stages. Dengue starts with chills, headache, pain upon moving the eyes, and low backache. Painful itching in the legs and joints occurs during the first hours of illness. The temperature rises quickly as high as 104 F 40 C, with relatively low heart rate, bradycardia, and low blood pressure, hypotension. The eyes become reddened. A flushing or pale pink rash comes over the face and then disappears. The cleansed lymph nodes in the neck and groin are often swollen. Fever and other signs of dengue last for 2 to 4 days, followed by a rapid drop in body temperature. the fever sense with profuse sweating. This resists a period with normal temperature and a sense of well-being that lasts about a day. A second rapid rise in temperature follows. A characteristic rash appears along with the fever and spreads from the extremities to cover the entire body except the face. The palms and soles may be bright red and swollen. How is dengue fever diagnosed? The diagnosis of dengue fever is usually made when a patient exhibits the typical clinical symptoms of headache, fever, eye pain, severe muscle aches, and petechial rash and has a history of being in an area where dengue fever is endemic. Dengue fever can be difficult to diagnose because its symptoms overlap with those of many other viral illnesses, such as West Nile virus and chikungunya fever. In 2011, the U.S. Food and Drug Administration (FDA) approved a blood test to diagnose people with dengue fever, called the DENV Detect IgM Capture ELISA.